case you're wondering, this is it's called a chemo cream.
Yeah, these creams will light you up. So, one of the reasons why we use topical chemotherapy creams in dermatology is to treat actinic keratoses, which are considered precancerous lesions to squamous cell carcinoma. Actinic keratoses most commonly develop due to chronic sun exposure and UV damage. Actinic keratoses are typically better felt than they are seen, and they feel kind of rough, like sandpaper, like little patches on the skin, and they don't quite heal very well. Now, sometimes we can see them, and they can look kind of red and very scaly. If a patient just has a few very distinct actinic keratoses, we often just freeze them with liquid nitrogen. But if a patient has many actinic keratoses or a lot of actinic damage, and we cannot quite see where that damage starts and where it stops, we'll often utilize a field treatment, such as topical chemotherapy creams like 5-fluorouracil or Efudex, to cover that. We usually prescribe these medications to be applied twice a day for a couple weeks at a time, depending on the location and the severity. But during the treatment process, as you can see, the skin can undergo a lot of serious inflammation and sometimes blistering, and we always ask that patients avoid sun exposure while going through this. But after the treatment, the skin typically looks extremely smooth and it looks great.